All right, I'm Angela Scott, and I'm going to be doing a straight catheter on a male patient today. So first, I will tell you my 12 safety practices. First, I'm going to perform hand hygiene before and after the procedure. I'm going to, or gathering any equipment. I'm going to verify the policies and procedures of the facility, gather all of my equipment needed, and verify the manufacturer's instructions. Then I'm going to knock on my patient's door, note the overall care of my patient, introduce myself, explain the procedure, and provide for privacy. I'll raise the bed for good body mechanics, and I will don any PPE if necessary. And then I would perform the procedure. I would lower the bed, lower the bed rails, and I would lower the bed rails, and give the patient their call light, make sure that it was in reach, and then I would report any abnormal findings to the charge nurse immediately. So now what I'm going to do is make sure, obviously I have all of my equipment here. I would check my packaging for to make sure that it's not expired, to make sure that it's all intact. And then I will slide this out, put this in the trash can, and I would provide pericare for the patient if needed. And I would provide pericare if necessary, and if the patient was uncircumcised, I would make sure that I pulled the foreskin back, cleaned it, and then replaced it when I was finished. Set that there. I'm going to open my kit now.
Mommy had my gun.
Shh. And I'm going to make sure that my patient is positioned properly, and pull this using my 1-inch border, pull this back, and I've got sterile gloves here, so I'm just going to remove these sterile gloves. I'm not going to use them. And I have this blue pad that I am going to place under the patient. I'm going to come around so that I'm not in my sterile field and I don't contaminate my sterile field. Place that under my patient as such. And then I've got this little thing that I will go ahead and place over my male patient. And then I'll adjust it as I sterile glove. And then I will go ahead and put my sterile gloves on. And get ready for the procedure here. And so now what I'm gonna do is I've got my specimen cup here, and I've got the lid, which I'll set here face up. There's a label, but the facility has already provided a printed label for us, so we won't need that. So what I'll do with my specimen cup is I'll set it here. I'm actually gonna turn this. And I've got my tube here, and what I'm gonna do with this part is I'm gonna put it in that little holder there. And I've got lubrication jelly that I would open, and I would place the end of the catheter in there. And then I will just set that there until I'm ready for it. And then I've got my cleansing swabs, which I will open. And set here. I would throw this in the trash. Now what I would do is I would adjust, since I'm sterile glove now and I can kind of touch this, I would adjust, and what I would do is straighten the penis and hold it there. I would let the patient know, hey, I'm going to touch you, maybe a little bit cold. So I would hold this, and then I would take my cleaning swabs out. and I would go in a circular motion right around the meatus, and I would clean in a circular motion and discard, and I would just kind of work my way out, clean again, discard, and the last one, work my way around, and I would discard. Now what I would do is, set that there, I would take the catheter out of the lubrication jelly, and I would let the patient know that I'm going to insert the catheter into bear down. Take a deep breath and bear down, and I would insert the catheter until I started to see urine, which I can see urine here. So at this point, I'm going to use this hand, and I'm going to hold it here so that it doesn't come out. I'm gonna make sure that it's in properly. And at this point, we're gonna have urine flowing out. So I'm going to collect the sample necessary, and I would set that there. And then the order is also to discontinue the catheter. So I would come into the patient's room, let them know I'm gonna discontinue, and I would ask the patient to bear down, and I would just remove the catheter, and I would wrap it in my gloves. I would provide pericare if necessary, and then I would clean everything up. I would put on new gloves, new clean gloves, and I am going to cap my urine sample, make sure that that doesn't spill. I would place the label on it that the facility had given us. I would note any issues with how the patient took the procedure, and I would report that immediately to the charge nurse. Again, I would provide pericare for the patient, and if the patient was uncircumcised, I would put the foreskin back in place and make sure that the patient was comfortable, and I would clean up, and I would be able to leave the room. Thank you.